Hey everyone, welcome to the AAFE Training Center. It's Crystal and I'm here with one of my wonderful patients. Today we are going to be doing some smooth threads in her neck and submental area. And then as you can see, she's all marked up for her Botox. So stay tuned. Okay, so I'm just gonna talk through marking her up for her smooth threads. She was already cleaned off. We have numbed her with BLT for 10 minutes and now she's all cleaned off. I used alcohol, made sure she was really nice and sterile. So I'm gonna go in with my marker because I really just like to know where I'm about to be placing the threads. So as you can see the faintest of necklace lines that are kind of going across her neck here, and then there's one just directly below. So we're going to place smooth threads directly into those necklace lines. And then we're also going to do just a little bit to help tighten up some of this tissue up here. So when I'm marking these, I tend to just go in and draw little lines. It doesn't have to be perfect, but it kind of just gives me an idea of how many I think I'm going to use and kind of just a treatment pattern so I'm remembering what I'm doing. And then we're going to put some up here as well. And that ends up being about 20 threads in that whole area. So now we're just going to sit her back and get started. Okay, so I have her laid back, so I'm just going to go ahead and get started. This procedure is fairly comfortable for most patients. That initial poke is kind of the worst of it, and that's why we use the topical BLT to really kind of try to help take that edge off. But you can see I'm just kind of placing them one after the other. We are actually using the V-Soft smooth threads, and we are using 29 gauge by 30 millimeter length. You can see around the neck it can get a little tricky because obviously there's the curvature. So I think I'm just going to twist and pull these as I go, just because we can see this one's trying to slip out a little bit. So I just don't want to risk it falling out. So I'm just going to twist and pull as I go. How are those first few? Not too bad?
No, not too bad. Just a little pinch.
Okay. So this is her first time getting smooth threads in this area. She's had them in other areas on her face, but never in her neck area. So, and it tends to be very quick. See how I'm kind of measuring where I want to go before I get it in. We typically find that 10-minute mark is ideal, the sweet spot for becoming nice and numb for this procedure. Oh good, I gave you a nice little bruise there. Again, very common. Always tell your patients, expect swelling, expect bruising, because it's gonna happen. Turn your head that way a smidge for me. Perfect. Always redirect your patient. Try to get them in a comfortable spot for you and for them. All right, and before I do under her neck, I'm just gonna hold some pressure over this bruise. Sorry, I'm gonna push it. No, it's weird right on your throat. You have a nice little hematoma. So I just held a little bit of pressure over that because she's got a little hematoma there. So when we're done, I'll just give her an ice pack to hold on there as well, and that will definitely help with some of that swelling for it to go down, but it's truly not that bad. So this area, I just chose this treatment pattern because I think that it will work best for her. There's really no right or wrong, but you can see how quick these procedures really go. Once you get the hang of it, they kind of just go in nice and smooth and easy. Just a few more. Once you get these threads in that correct plane, you can see how nice and easy they just slide right in. That kind of lets me know that I'm in the correct area, in that safe area where she's going to get the best outcome once these threads break down. All right, and that is done. So I'm just gonna clean her off and then we'll sit her up and move on to her Botox. Okay, so we're gonna go ahead and get started with her Botox. So she's had Botox once or twice, so she kind of knows the drill with this. But just very little pokes, making sure we're treating the entire frontalis. She's actually receiving Xeomin today. She's gotten it in the past, has gotten really nice results with it, so we're sticking to it. Turn towards me just a smidge. Perfect. And we love to use the ComfortTalk syringes. They're just really nice. They're itty bitty needles. They're only 31 gauge and they're super sharp, so they get into the skin fairly easily. And the Botox kind of pushes right out of them. So that's her forehead. So now we're moving down to her glabella region. So we're treating these muscles, which are depressors, to really help kind of soften those 11s that you get in between your eyebrows when you make an angry face. Good. And then we're going to move to her crow's feet. So she's getting the same amount on both sides. That's not always the case with everyone. As easy as that. And then I'm going to have you turn towards me. Perfect. Perfect. Then let's see, I'm gonna go ahead and treat her masseter. So you can see I have her borders marked on either side, which are very important when treating that masseter muscle. Go ahead and bite down for me. I can feel the bulk of where that muscle is. Relax. Wonderful. Sneak over to the other side. I'm gonna have her do the same thing, bite down. Wonderful, relax. Okay, and then let's look at, we're treating her mentalis, so this muscle in the chin that's responsible for this mental crease, and then go ahead and make a sad face. That like pebbling appearance to the chin is what we're trying to work on relaxing. And these injections sometimes can be a little spicy. Good. And then we're treating her DAO, her depressor anguli oris muscle. So go ahead and make that like Hulk face. It's responsible for pulling down the corners of the mouth. It contributes to the downturned oral commissures, and it kind of interacts with the platysma bands as well. So we're just gonna go ahead and treat that. Towards me a smidge. One more time, pull down. Good, relax. And last but not least, a lip flip. Save the best for last, right? So it's always a little spicy. And a lip flip, unfortunately, is more pokes than radial lip lines, but I like to pull it nice and tight to make sure that I'm just slipping right into that tissue. You all right?
Mm-hmm.
Definitely is a tearjerker. Gonna just sneak on the other side. Two more. Done. All right.
Thank you.
All right, so let's just start cleaning her off. So cleaning off is just as important as the injection because we always tell patients don't touch your face, so we don't want them rubbing it around. So cleaning off in a manner that's appropriate so we're not moving that Botox into any other muscle that we don't want it to be in. And letting your patients know to not touch their face for 4 hours. We also say don't raise your body temperature for 4 hours. So not only exercise, but even being in a hot tub or a sauna. Sorry, a little stingy around your eyes. Or even just sitting out in the sun can raise your body temperature. So keeping all of those things in mind and letting your patients know that this Botox will kick in at around 2 to 10 days. It's usually at its max effect at 2 weeks, hence why we bring them back for a 2-week follow-up and see how everything is kind of settled in and taken and decide, do I need to add more or are they good to go? And that is okay. So we have finished up with her treatment. We just did her smooth threads in her neck and her full face of Botox. So at the end of this video, there's going to be some before and after photos of her. So I kind of just want to go over some of the stuff that we've done with her in the past so you can really appreciate those changes and see the difference in the before and afters. So come on in. I'm just going to do a quick little run over of what we've done for her so far. So she's obviously had a full face of Botox once or twice now. We've done some smooth threads into her glabella area to really help kind of relax those deep set in 11s. She's had her lips. We've done some smooth threads around her lips as well. And most importantly, we've done lifting threads on her. So she was kind of right at that sweet spot where we were going to get the best result. Not a lot of tissue to lift, but it was starting to bother her. So we did some lifting threads on her. Almost like 2-ish months ago, maybe longer.
I think 3. Yeah.
Okay, so that's perfect. Because usually when those threads start to dissolve, we say that peak collagen is usually around 3 to 6 months. So we'll get to really appreciate that after photo. So thanks for watching, everyone.
Thank you.